Can changing how we deliver healthcare really reshape a nation's economy and its society? Welcome back to Global Lens Macro to Micro. Today we talk about healthcare reform, and healthcare isn't just a moral issue, it's also an economic one. Economic models do allow us to ask a vital question. What happens next when we reform healthcare? First, obviously, there's economic consequences to healthcare reform in terms of government spending and budgets. Reform often increase public healthcare spending initially, but this can be an investment, not just a cost. The best example is the ACA, which initially raised costs but reduced the federal deficit in the long term. Then there's, of course, private sector adjustments. Businesses may reconsider offering private health insurance versus public exchange options. Pharmaceutical firms, in turn, may face price regulations, thereby affecting global R&D priorities. There's also labor market effects, may remove the job lock, increase labor mobility, entrepreneurship. Healthcare reform may improve access, which then boosts productivity and reduce absenteeism. Finally, as always, there's administrative and innovation shift. Transitioning to more efficient systems like single-payer models can cut down admin costs. Reform can either pressure or incentivize innovation. Think of telehealth and its growth during COVID. So the question is, healthcare reform should prioritize cost savings or innovation, and why? Let's now examine the social consequences of healthcare reform. First, in terms of access and equity, it can expand coverage, increase access, particularly for underserved groups. As an example, again, under the ACA, 20 plus million Americans gain insurance. It impacts outcomes and prevention. Consistent access improves health outcomes and reduces emergency care reliance. The focus shifts from reactive to proactive care, managing chronic disease earlier. It can reduce disparities. Reforms can close gaps in healthcare linked to income, race, or geography. But reforms must be designed with equity in mind to avoid new disparities. Lastly, in terms of public trust and cultural shift, perceptions can evolve over time. Initial skepticism can turn into strong support. Healthcare reform can normalize preventive care, reduce stigma, and shape healthier habits. So the broader picture, why it matters, those healthcare reform, it's not just about cost or access. It's about social resilience. A well-designed reform system can save lives, reduce poverty-related illness, foster social cohesion and trust in public systems. But poorly implemented reform can lead to fragmentation and backlash. So to recap, from an economic perspective, reform impacts budgets, labor markets, and innovation. From a social perspective, reform changes who gets care and how societies view health. So when done right, healthcare reform isn't just a policy win, it's a social transformation. Thank you for watching. If you like this video, please click the thumbs up and subscribe. If you have a topic that you want me to discuss in my next video, please let me know in the comments, and I'll see you next time.